you can't get mad. If you're having a conversation, you're asking your child to trust you and to be open with you, you have to be prepared that it's probably going to be something that you're not ready to hear. As a parent, if you know they're using, just say, I want you to know that if you ever feel like doing that or have ever done that, you can come and talk to me about it. And it's okay.
Substance use disorder touches all our lives, and often we feel hopeless or frustrated in our pursuit to understand how and why it happens.
Welcome to APC Recovery Cafe, where we discuss the topics and trends around substance use, provide education and resources, offer recovery support, and also discuss prevention tactics, all through the stories of the people who have been there.
We invite you to grab your favorite coffee or tea and join us for a variety of guests that will bring understanding, information, connection, and hope.
Together, we can break the stigma and pave a brighter future for each other.
Hi guys, welcome into this episode of the APC Recovery Cafe. I'm Art Wimberly. I'm a person grateful to be in long-term recovery and one of your studio podcast co-hosts today. And in the studio with me, we have Edward Taylor on staff with APC. Edward, good morning.
Morning, sir.
Yeah. Who's your guest today?
Our guest is Candace Rachel, Rapid Response Coordinator for the Overdose Data to Action Task Force team with Jefferson County Department of Health.
Correct.
Oh, God, I nailed it.
You did.
So tell us a little bit about that. Like, what is the purpose of that?
So
program?
The Overdose Data to Action is a grant from the CDC that they gave to the Alabama Department of Public Health. And in Alabama, there are 2 independent public health departments. All the rest are under ADPH. And Jefferson County and Mobile County are the 2 independent ones. And we are, Mobile County and Jefferson County are subsidiaries of the grant. So ADPH gave us the grant money along with Mobile County. And so with the lead of Dr. Traffinstead and Dr. Wilson, we do a lot of Narcan training or Naloxone. We like to call it Naloxone now because that's a generic name and it's able to be generic now. So we go out and do training for individuals who want to get Naloxone so that to save somebody's life. Mm-hmm. And then we also mail it. We have a website, Jefferson County Department of Health.org. And you can go online and do the training, and we'll mail it to you.
So why has that become so important over these last few years in terms of whether you call it Narcan or Naloxone? Why has it become so important for training?
It's so important because it literally will save somebody's life that has an opioid overdose. And right now, the percentage of street drugs that have an opioid put in them unknowingly to the people that are using it is fentanyl mostly, and it will kill you very quickly. And we've had, just in the past year, the overdoses, the age of death and overdose treatment is getting younger and younger. It's starting to get into college kids, and the reason is because they have pill presses. You can get them off Amazon, super easy. They're not expensive, and the dealers will put fentanyl in, maybe if somebody wants to buy a Xanax, like part of it is Xanax, and then part of it's fentanyl. And so young kids that are experimenting with drugs for the first time, they think it's cool. They want to, either have Adderall. So, they'll make Adderall, and it looks exactly like what you would get as a prescription.
Yeah. So some of these folks are taking it thinking that if they're buying Adderall or a Xanax, they're thinking they're only going to get that effect from it. It's either going to calm me down or speed me up to study or whatever it might be, not aware that they're buying something illicit that has something in it that may kill them.
Correct.
Right.
Yeah.
I think So one important, I guess you could say, plug or something we should reemphasize or reiterate is that, because we were talking earlier about how the general public, the perceptions and the
Risk perception.
risk perception, and then just the overall knowledge of the situation is getting better, but there are still people, just members of society, who don't know a whole lot about Narcan, and if they, or Naloxone, and if they do, latest they heard was, oh, it's, an exorbitant amount of money, but you can get it for free from JCDH.
Correct.
Yeah,
as long
so-
as you're in the state of Alabama, we can mail it to you.
Yeah. And how does somebody do that?
So you can go online and do a training. There's a video. It's a 7-minute video. And then we also have fentanyl test strips, because we all know if we tell somebody not to use drugs, that's not really going to happen. It's not a good thing. I mean, it's a good thing to say it, but it's not effective.
Right.
So, our goal is to have harm reduction, which is, sometimes very difficult to talk about, but
Basically, we're trying to help keep people alive long enough to get them the treatment they need.
yes. And so you can go online and watch the video on how to use it. You can either choose to get just Narcan, or you can choose to get both fentanyl test strips and Narcan, or you can choose just to get fentanyl test strips. And we'll mail it. It comes in an email to me, and I put the address that you provide on an envelope or on a box, and it gets sent off.
It's sent with love if it comes from Candace.
Very much so.
Lots of love.
Yes.
The other thing I was going to mention, so we've partnered with y'all a lot over the
Yes.
years. And I think it was like a year ago, we were all out to eat at Jim and Nick's. And I think it was either you or Sarah or Dr. T or all three of y'all. Dr. T is Dr. Travenstead.
Correct.
Mentioned how y'all are treating overdoses and I guess opioid addiction like a infectious disease. And I had never heard that interpretation before. I thought it was genius. Can you explain what y'all mean by that though?
So, if you think about COVID, I hate to mention that word, but, it's tracked to how it's transmitted from person to person. And there was what they call epidemiologists that look at how it affects a certain population more than another. And so with drug overdose, we started looking at having an epidemiologist kind of look at who's higher at risk, what population, is it a certain area, is it people that are educated, not educated. And the reality is that everybody at some point uses some type of drug. And like cigarette smoking, alcohol,
Prescription
drugs. Like, I know, like I go to the doctor and, I've been given an antidepressant or a Xanax for anxiety. So when you think about a substance, that's what it's not a specific population. And people don't like to talk about it. That's the biggest thing.
The other thing that, the way I was hearing it, and one of y'all had described it too, is like if you think about, using COVID, for example, let's say, just as an example, before you came here, you encountered somebody at the gas station or something that had it and you didn't know. And then you came here and you didn't know. And now we're in this room and, one of us leaves with it and we go somewhere and, and spread it like that.
Yeah.
Same thing could be said with like a batch of heroin that's actually just almost entirely fentanyl. Maybe they don't know it. They sell it to one person and that person, or it starts, in spot A and they cut it up and send it to 4 different people in B, C, D, and E. And then one person buys a bunch and gives it to that person. And then it spreads like that. because y'all take, do you get the zip codes of where overdoses take place?
Yeah. So
And then you can kind of,
we get a coroner report every week, and it says where the individual was found. So, I mean, we have specific addresses that we can see. We don't put that out in public
right.
for, a lot of reasons. And then I have access to EMS data. And so when somebody calls 911 and it's an overdose call, I get that information and I can look at it. It's Jefferson County and then all the counties that touch Jefferson County. And you can literally see the line. Like, you can put single dots on it or a heat map, however you want to look at it. But you can see when there's a bad batch, so to speak, of something because it runs through a neighborhood like COVID would.
yeah. And then we at the APC, we get that information from y'all, not the specifics, but
the
very
geographical
trends, and then we'll use that to maybe take a pop-up resource fair to that spot, or just put more advertising there. Like we ran a campaign, Be a Hero, we might run it there. I think we actually did that, but
Yeah.
that's just, I love it. That's
Are there any geographical areas that we might be surprised have been hotspots before?
Yeah, I mean, it's pretty frightening because there's not one area that's been completely untouched of it. But a lot of people think that it's going to be, downtown, the parks where there's a lot of homeless individuals, and it's not like that. There is, several in a lot of so-called affluent areas in Vestavia or Homewood or Mountain Brook. And, even like I live out in St. Clair County, it's not, you think rural areas, you think that it's not going to be there, and it is. It's very, very heavily there.
So you're RN,
Yes,
MBA as well.
correct.
Was there, how did you set out? Did you know at some point in the past, I really want to start doing more work around opioid overdoses or just treatment of opioid use disorder in general? Or was it something you kind of, I'm not going to say fell into, but kind of stumbled upon and you're like, oh, I might want to do that? What led you to this point professionally?
So I have always, as a nurse, I've been a nurse for, 30 years. And I think for me, I always enjoyed working with people that were, I guess, what a lot of people would call less fortunate or
Less resourced.
less resourced. Yeah. And it was probably a selfish reason to begin with, because it made me feel good. And so it was kind of like, that was the drug for me. The drug of choice was to work with people that were underserved and in different areas and also very misunderstood. I worked in the prison system in Alabama. I was the director of nursing for mental health for the contract company before this company took over. I'm not even sure what company they're on right now, but I was part of the regional team, and I always joke and tell people some of the nicest people I met were murderers, for real.
Yeah.
And I think, you start to take for granted stuff that we go through every day. When you go to the doctor, they take care of you, you get a prescription, you can tell them, no, I don't want to do that. No, I don't want to do that. And then that is a really big thing in community, in your life, to be able to have that freedom. And
You have options.
Yes, absolutely. Like if I don't like that doctor, I'm going to go to a different one.
But a lot of the populations you've served over the years don't have those options.
No. And so when I ended up leaving the prison system, and I've worked for mental health. I did a lot with mental health, behavioral health now, I guess is what they call it. But within, with a lot of individuals. And I don't know why I just had like this draw toward that. And it's kind of a scientific thing for me. And like you said, you like to see how things work. How does that A, B, and C, how does it connect? And it's kind of like that with the brain for me. I find it very intriguing and always want to learn more about how does one come to that crossroad, like why, like, I mean, you see it all the time, like siblings, you'll have one person that is in the midst of heavy addiction, and then the other sibling is just not even.
Why were they not tempted, or if they were tempted, why could they put it down easily?
Yeah, and
coming
why
from
are
the same family of origin,
raised the same way?
Yeah, genetics,
everything.
So I've mentioned a few times like the partnership that APC has with JCDH. What do you think some of the events that we've partnered on would have been some of your favorite?
Oh man,
in any way?
I absolutely love our pop-up resource fairs.
They're good.
They're incredible. I have learned so much, and I think that's one of the cool things. Like you reach out to people, and they're just so, like they will tell you what's going on in their life and what you can do to help them. And I think people don't understand that when we do pop-up resource fairs, we're not there to like solve every problem in the world, because we would be emotionally exhausted if we could. But I think just having people be like, wow, this is great that you guys did this. I mean, I think the fountain one was really cool.
Yeah. We like to do them. We'll take, like I said earlier, the data from the OD2A, and we'll intentionally go to one of the overdose hotspots on there, and we'll bring resources. Obviously, JCDH will be there for Naloxone training.
Recovery Resource
And then
Center.
we'll have Recovery Resource Center, Ross.
Housing.
So, in general, it's recovery support, it's treatment for substance use disorders,
One roof.
housing,
One
one
roof,
roof, housing, food, because these are generally areas where housing and food is needed. And then I think I tried to get some mental health resources there last time. I can't remember if we did or not, but all that stuff. And it's great. Yeah, we love it too because it's
you're making contact directly
direct
in
contact.
the areas with the people that need the resources, and some can get them that day, but some actually find them later through some of those connections.
Yeah, it's just like planting a seed somewhere that may grow.
Yeah.
Yeah, it's awesome. I had never been to End Heroin walks, and then they changed the name to End Addiction. And I think that was probably one of the most humbling experiences that I've had with APC. I did that purple ribbon, and people, I got to figure out, I still have where people put loved ones' names on their, little heart or an angel or a butterfly, and they wrote it and pinned it on the ribbon. And I look at it on a day-to-day. Like there's some of them that I put up in my cubicle at work just to remind me that that's why we do what we do. Because sometimes the bureaucracy of everything kind of gets in the way, and you forget about what the purpose is, like the true meaning of it.
So are you seeing any trends? And we've had the 2 years of pandemic, which wreaked all kind of havoc on the gains that were being made, right?
Yeah.
The isolation, the stopping of community, all those things came into play. Has there been enough time recently just begin to see any reversal of any trends, or are we still going in the wrong direction?
Well,
Can you tell?
We did so monthly we do a overdose task force meeting, and it's regional. So there's ADMH is on there, ADPH. We Birmingham Fire have recently joined us. Some law enforcement have been on, and Dr. Trappenstead did like a graph of the amount of overdose deaths, and it is starting to trend a little bit downward. I hope it stays going downward. It's just that the trend that we see right now is the age of death is starting
Keeps
to
going lower.
decrease. Yeah. Not that any death is worse than another.
Yeah. Well, it's kind of like the perception of risk it seems to keep falling in
Yes.
a sense. And so that may be one of the reasons younger folks are dying, because the perception of risk at any level seems to be gradually falling over the generations.
Yeah.
I know, Edward, a lot of stuff y'all do in schools is actually measuring some of that.
Yeah.
And that doesn't seem to be going in a good direction.
No. Yeah. I think it's just, when I was young, and I don't know how old you are, and I'm not going to ask, but when we had drugs, marijuana was usually that drug of choice when we were kids. And we knew the person that grew it usually.
Yeah.
You knew it. You knew where it came from. And with all of the current legalization of marijuana and the perception that it's safe for adults, and adults that used when they were younger, it's not the same type of marijuana.
Much more high potency now.
Very much so. And you don't know where it's coming from. Yeah. These kids will buy stuff off the, you can get it delivered to your house. It's we were talking to one kid that had overdosed, and he said it's easier than getting pizza delivered to your house.
Yep. Through social media.
Yeah.
Yeah.
It blows my mind.
Yeah, I wonder if someone actually has probably already figured this out, so I don't know, but it seems like it might be a threefold kind of cause, which would be the lower perception of risk, maybe some lingering effects from COVID-19 mental health wise, because we know that mental health and substance use disorder are intertwined. And then also that fentanyl is being found in more and more, or basically all drugs at this point.
It is.
And so, I would think that for the most part, the most common drugs that are used by teenagers are probably the same. I think we probably have data on that upstairs or downstairs that I can look at, but it's just now there's fentanyl being found in that. I mean, I'm a certified peer, and I do work specifically with adolescents, and several patients or clients, whatever you want to call it, peers that I've seen there over the last few months, overdosing on marijuana, and it's not the THC, of course. It's fentanyl, and it's not intentional. They didn't.
Yeah, a lot of people are buying these products not because they think fentanyl's in it.
Yeah.
If they wanted fentanyl, they just
Yeah.
they'd go and buy fentanyl. Trust me, that's what would happen.
Yeah. Well, we did that last week.
Yeah, exactly.
Yeah. That was a joke.
I know. I did that many years ago.
Yeah.
I'm a new person now, Candace. So I think that's part of it too.
And I think parents don't understand the differences in marijuana today that it was back when we were young.
Yeah.
I would have, Like, and because you talk to parents and they're like, well, it's just marijuana. Like, I smoked marijuana when I was younger. And I'm like, yeah, I know it is, but it's not the same, y'all. It's not the same. And it's not okay.
Yeah.
It's not okay for a lot of reasons. One, and I always tell people, it's illegal. Like, you don't even, like, when I got caught drinking or using drugs, marijuana, when I was young, the cop literally would take it from me and say, go home or I'm going to call your parents. And it's not like that anymore. Like, you end up with a record. And then, that opens up a whole nother hole of, trouble for you. So I think parents don't really, like, it's illegal also the way that it affects the brain before that it's fully,
Yeah.
developed.
Causing a lot more development of mental illness today than ever before.
Yeah, it causes, you have a predisposition to schizophrenia if you use marijuana when you're younger.
And even if it doesn't go that far, the decrease in executive function and goal setting and dreaming and visioning about
Emotional
life.
intelligence
Yeah,
as you go through
yeah.
life. Yeah.
Yeah.
And so a lot of times you're not, and that's what we kind of talked about earlier, is like you don't educate yourself on that or know about it unless you're in that field or directly affected by it. And so for me, like, my kids hated me when I was, when they were growing up, and they probably still hate me now, but, I just was not naive about stuff because I saw it as a nurse and working with the populations that I did. And I was really not, I wasn't fooled by, the typical, lie thing. I was going to say white lie or fib, but it's a lie. So It is what it is. And it's natural for them to not tell the truth to their parents. That's the thing. Like, it's natural for them. There's a lot of, whether it be shame or they just don't want to get in trouble because they know there's going to be a consequence most of the time. And so, when parents aren't on point with that, it turns into a mess. And they need to be on point, period.
Yeah. One of the a lot of those kids that I see as a peer, adolescent peer, is marijuana is frequently, a thing of it, or frequently their drug of choice, I guess you could say. And it can be tricky because of that perceived risk, and because the societal, I guess you could say, attitude towards it has changed a lot, which is interesting because it is, even from when I was younger, it's a whole different. It's a hallucinogen at this point.
It is.
But anyways, I try to explain to them, like, I tell them up front, I'm like, I'm not the person that's going to come in here and act like, even with how strong marijuana is today, I'm not going to act like that's the same as heroin. Like, I'm going to be realistic with you. It's not.
It
like,
is not.
You're not. It's not. But I try to tell them a few things. I'm like, first of all, I kind of hit them with a risk reward analysis. And I'm like, let's sit here and talk about all the risks associated with this, you using marijuana. And it's endless, of course. I mean, they don't say that, but I do. I'm like, okay, well, let me help you with that, And then I get to the reward, and I'm like, you feel high for a certain amount of time, and whatever it is, because I'm a firm believer that ultimately there's something they're using about or over to self-medicate for, most of them. I say that feels better for that period of time too. But as soon as that's over, you still have the same problem. It's not a solution to that problem because you still have it after you're done feeling high. Yeah. And it's probably worse, So I try to work that into them, but I think they respond better to having someone tell them, like, listen, it's a different drug from heroin, meth, crack. Like, that's not what we're talking about here. But it certainly sets the stage, as my experience shows, and pretty much everyone else I know in recovery, their experience shows too. Like, it sets the stage for something bad later on, usually, you know.
Well, you don't learn how to communicate. Like, one of the things I find interesting is when you have a difficult issue or you have a disagreement with anybody. I mean, we have them on a day-to-day at work, you know. You have it all the time in every aspect of life. Like, you don't learn how to communicate that effectively.
And resolve conflict. And
like conflict to people is like automatically, if you say the word conflict, people think that like it was a huge fight. And that's not, I think conflict is a very good thing to have if you have
part
it
of
in a
everyday
healthy
life.
way.
Yeah.
And so I think for individuals that, you know, a lot of the parents don't know how to resolve conflict without certain things that happening, you know, in a negative way. But I think that's what we need to be able to have conversation. And I think that with the drugs, you know, and we talked about this too, is like, if it's my child, I can escalate very easily just because I'm so personally involved. And you just know you go through 100 zillion questions like, I don't understand why they're doing this. I know I didn't raise them like this. They're, you know,
A lot of emotional baggage in there.
Yeah.
Yeah.
And if it's not your child, you are able to kind of compartmentalize everything that's going on and maybe able to help somebody that is not, you know, that's going through some stuff, and the parents even can't communicate very well. So I think part of that, we were talking about like getting back to communication and how to resolve issues, because when you don't do that, you look for another coping mechanism. And the coping mechanism, if it's not a healthy one, it doesn't help resolve. And like you said, it does make it worse, you know?
I think one thing that would be really helpful for our listeners, because so many kids smoke marijuana now, or the parents are concerned about it. What kind of tips can you give to parents in particular about how to navigate that? So specifically, like how they can have a conversation with their kids about it if they're not using it, but they want to open that dialogue, or how can they have that conversation and confront the situation if they know their kid is smoking marijuana?
I think the biggest thing for me has always been that you can't get mad. Like, you can't get mad. You have to sit, if you're having a conversation, you're asking your child to trust you and to be open with you, you have to be prepared that it's probably going to be something that you're not ready to hear.
Yeah.
And that's okay that you're not ready to hear it, but you have to be able to hear it and listen and take that step back and say, you know, let them talk, let them tell you what they're feeling about it. Don't say, well, you shouldn't do that. Because I know that that's like one of our first things, like, you can't do that. Don't do A, B, C. And they're like, okay, well, I'm never going to talk to you again.
Yeah.
And so if you, as a parent, if you know they're using, like, let them say, you know, what are you using? Tell me what you're using. And not in a, like,
judgmental or accusatory. Don't make accusations or.
Yeah, like, are you, you know, are you smoking pot? And when they say yes, say, okay, well, how often do you do it? Is it something like, why do you do it? What's the reason? I think it's important that, you know, some kids are just going to try it just because they're going to try it. That's just what they're going to do. But I think that with kids that use it a lot, and by a lot, that's varying, but do they use it after they get into an argument with their parents? I think it's important to ask that question, like, how often? And if it's somebody that is not using, if you want to check just kind of do a drug conversation with your
prevention
kids,
conversation, yeah.
Just say, I know that there's marijuana out there. I know that, there's pills out there that people, and your kids are always going to say, well, I'll never do that, Mom.
Mm-hmm.
And that never do that, Mom, is a huge lie.
Yeah.
And so just say, well, I want you to know that if you ever feel like doing that or have ever done that, you can come and talk to me about it.
Yep.
And it's okay. You are not your child's friend. There's a big difference.
Mm-hmm.
You're still a parent, but you have to teach them, and you teach them through your action on how they can communicate healthy and effectively. And if you're talking to your child like they're an idiot and like you need to tell them everything to do, that's what they're going to behave that way.
Mm-hmm.
And so I think open communication and just being honest and focusing on, not blowing up.
Yeah. That's really good advice, especially, having that conversation and not judging them. A few things that I'll add, preface this by saying I don't have any children, so I know, and sometimes it's good to have somebody on the outside to give advice, but I understand this is all easier said than done. It's difficult when it's your child and you love them so much. But one of the first things that comes to mind, and I frequently tell this to parents, and before the APC, I worked at a treatment center and loved doing consultations with adolescents and their parents. And I would try to explain to them, at that point, again, we're talking about kids who are using it. So I would say to them, you cannot, well, I wouldn't say it like that, but I would say it does not help to get mad at them at this point. It's not going to do anything.
It probably makes it worse.
Makes it worse. Yeah, it does. Which makes them probably want to smoke again. So I try to explain, like, the best thing that you can do at this point is to go to them and say, hey, I'm a little frustrated with you because I don't want you to be doing this because you're hurting yourself and you can't tell. But I want what's best for you and I want to help you, so I'm not judging you. I maybe you're trying to self-medicate for something and I don't want to see you in pain. I want to get you help. And I understand. I forgive you. Whenever you want to talk to me more about this, I'm here for it, and then just leave it at that.
Yeah.
A lot of times the kid is just going to take that and either say nothing or still get mad at you or call you something. Just take it, because by you not responding, that shows them that you meant what you just said.
Correct.
You meant that with your heart. And they'll remember that. That'll stick with them because they might not want to talk then, but the next time when they're struggling and they're like, oh, Mom or Dad, like, maybe I can just go say something to them about this, like, I don't have to tell them everything, but I can talk to them and say, hey, I am kind of, I don't know why I smoke pot, or I feel like I can't stop. I had this bad experience with it. To the parent, that's your opportunity right there.
Absolutely.
So the other thing that I tell parents is, in that gap where you mentioned you offered that gesture or whatever you want to call it, after that, you need to be working on yourself.
Yes.
So if you need to go to a therapist and get advice from them and talk to them about it, if you need to go to Al-Anon, if you need to, whatever it is, so you can be prepared for that moment when it comes, because it will. I'm always confident that it will, that your kid, if you meant what you said, eventually they will want to talk to you about it. Mm-hmm. Might not be when you want them to, might take a while, but they will.
Just real quick, I just want to add that it's okay to know and admit that you're not equipped to handle something and to go somewhere for help.
Yeah.
To get the resources.
Yeah, and for parents and kids.
Yeah, exactly.
And I think it's important because parents don't, you're not equipped unless you're in this community, basically.
Yeah.
So,
So as we close out, can you tell those that are listening if they're interested in getting more information or finding out or even supporting what you guys do, what's the best way to get in touch with you or the organization or the website?
So you can go on the website, Jefferson County Department of Health. It's jcdh.org, and make sure it's the Alabama of Jefferson County, because I didn't realize there was several Jefferson counties throughout the country. But you can, there's a Naloxone line. You can go on the website and do the Narcan or Naloxone and fentanyl test strip training. And then my phone number at the office that is the Naloxone helpline is 205-930-1065.
Great.
And that rings right to my desk. If I'm not there, you can leave a voicemail, and I'll get it when I get back. Like right now, I'm not at the office, so I might get back and have a couple of voicemails. Yeah. Or if you call anybody in substance use disorder area in Birmingham, they're going to know how to get in touch with us.
Well, Candace, thanks for what you do, and thanks for taking the time to come up and share with us today. And folks, thanks for joining us for this episode of APC Recovery Cafe, and we'll see you again soon.
One of the things that APC is known for is being a connector, because we're stronger together.
Not only are we there for those who are suffering through substance use disorder, but we're there for family members, and we really take our job seriously.
We all have personal reason why we're in this field. We're changing people's lives one community at a time.